Hello, everyone. Good morning, and welcome to today's webinar, 340B Rebate Management, Unlocking Cash Flow Predictability and Integrity in Reconciliation Within a Complex Landscape. I'm Amy Yang, a member of the Business Development Team at Longitude Health, and it's my great pleasure to serve as moderator for this discussion today. Over the next hour, we're going to cover how changes in 340B and emerging rebate models are reshaping financial realities, particularly for safety net hospitals. How the Inflation Reduction Act, or IRA, intersects with 340B and adds another layer of complexity. And finally, how Longitude RX, in partnership with Innovacer, is helping health systems address cash flow, data fragmentation, and reconciliation with a more unified and automated approach. I'm excited to be joined this morning by Jigar Tucker, CEO of Longitude RX, Shilpa Paul, Director of Product at Longitude RX, Michael Marchionda, Director of 340B Optimization at Longitude RX, and Maddie Schultz, Senior Director, Product at Innovacer, who will talk us through the Gravity platform and the capabilities behind our joint solution. While all of you webinar attendees are off the hook for the next hour from appearing on the Zoom screen, we do plan to broadcast a couple of live polls, so please be ready to respond to those. And we are planning to leave time at the end for Q&A. As you can see in your Zoom screen, you can type questions and submit them to myself and our panelists by utilizing your Q&A button. Any questions we aren't able to address live during this session, we will be sure to follow up with you after the webinar via email. So let's get started by grounding ourselves in who Longitude RX is and how we fit into this evolving landscape. Jigar, would you please kick us off with an overview of Longitude RX? In your own words, what is the overall vision and mission behind the company?
Definitely. And thanks, Amy, and thank you everyone for joining us today. I'll kick us off with that topic. So Longitude RX really was built around a clear reality. I think many of us recognize and know that specialty pharmacy has really become one of the most important and most challenging areas that our health systems face today. And believe it or not, 85% of our FDA pipeline is now considered specialty medications. And what that really means for patients going through health systems is that really any part of this patient journey is being managed by these health systems. So whether health system executives know it or not, a majority of your patients really are on specialty medications, and that the journey that they experience through their healthcare journey in terms of specialty meds really defines their patient experience, their clinical outcomes, and their overall prognosis. And I think given that specialty pharmacy is becoming really an important part of care delivery, our founding members, our health systems that founded Longitude Health, really wanted to establish a solution that really addresses the gaps that health systems are seeing today. Gaps such as complex prior authorizations, fragmented data, and really a highly regulated 340B program, which is what we're going to touch on today. But we wanted to address those gaps really with tools that are designed for that level of complexity. One thing I wanted to call out and really emphasize is Longitude RX was really created by health systems and for health systems. This is really meaningful because many times we see tech companies building solutions for health systems without really understanding the deep workflows and keeping those workflows in mind, right? So many times a new shiny company or a shiny software may seem attractive at first, but it's often, has trouble being utilized after that initial implementation. And the true impact on clinical outcomes and financials really often isn't measurable. And we really wanted to take a different approach with the Longitude RX model. Given that our health systems created us, we wanted to address those gaps very, very differently and not just have these solutions that are not as meaningful. So we really focus on our approach in two pillars. One is we have a deep health system expertise, right? Our health system team is really comprised of 340B program leaders, health system pharmacy leaders. Today you'll see individuals from the Cleveland Clinic, people who have worked at MD Anderson. We have people who worked previously at Stanford Medicine and many other health systems, as well as payers and the PBM side, and really even and previously successful startups. So we really brought a group of experts together that really know the deep workflows of the health systems before we design a product that really impacts those workflows. And then our second pillar is really having a connected data platform. And this is where our partner Innovacer comes in. We're trying to do this on the Gravity platform, which gives us the interoperability and analytics to really plug in all of our health system data into a much broader enterprise strategy rather than adding another silo. So today you'll hear from Shilpa on our platform work end to end, from Michael on our realities that health systems are facing, and from Maddie on how Innovacer is really enabling the data and dashboards behind it. And so let's touch on that a little bit deeper.
Perfect. Thank you, Jigger. Great segue. So, Maddie, why don't I throw it over to you real quickly to talk a little bit about, in case our attendees aren't necessarily familiar with Innovacer as well as the partnership with Longitude RX.
Absolutely. Happy to, Amy. For those of you who may not know us, Innovacer is a healthcare technology company that has been around for over 10 years, built around really this one critical mission is how do we activate the flow of data and AI to advance health outcomes for everyone and anywhere. And what it really means in practice is helping health systems work with less friction, more visibility, and just greater clarity across programs like 340B, which are fairly complex. We have evolved over a decade of our work into this one single platform we call Gravity, which is really an enterprise transformation engine that turns fragmented data into a unified intelligence layer that organizations like yourself can really actually run your businesses on. And that is why exactly I'm excited about our partnership with Longitude. It is super powerful because their deep operational expertise like pairs very well and naturally with the intelligence and the visibility that Gravity provides. Together, we're giving health systems the clarity and predictability that they need to navigate today's 340 beats complexity and the intelligence and insights to be ready for what's coming next. Something that simply does not exist today. So I'm really excited for the conversation ahead, Amy. So let me turn it back to you.
Wonderful. Thanks, Maddie. All right, well, I'm going to keep going around the screen a little bit. So, Shilpa, if I can go over to you, how about you start walking us through the end-to-end platform that Jigger mentioned, and start talking to us about where 340B fits into the broader ecosystem that we're hoping to solve for.
Absolutely, Amy. And I want to expand on what Jigger mentioned on specialty pharmacies. Specialty pharmacies in health systems manage patients with complex, chronic, and sometimes rare diseases, and they're utilizing these complex medications that are high cost, high touch. So these therapies require deep expertise. They require coordinated care. Oftentimes, they will require prior authorizations. They will require financial assistance and ongoing clinical management. At the same time, as Jigger highlighted, the specialty medication market is booming. It accounts for more than 50% of the total US drug spend. So the complexity of these medications is going to continue to rise. The challenge today is that specialty pharmacy workflows are disjointed and fragmented, as Jigger mentioned. Before a patient even gets a medication, a lot of work needs to happen upstream from benefit investigation, from prior authorizations, the financial assistance, even refill, and all of the other care coordination that needs to occur. And much of this work currently is being done manually across a very disjointed system. And that essentially leads to delay in therapy for patients, negatively impacting patient outcomes. There is a complete lack of transparency on the whole entire patient and prescription journey that sometimes leads to frustrations not only for the patients, but also their care teams. And even though there might be point solutions integrated into the specialty pharmacies, those point solutions are siloed and they're not integrated with the upstream and downstream workflows. So they're still still leading to disjointed care. And that is exactly why our Longitude experts have partnered with Innovacer to develop our tech-enabled specialty pharmacy platform. It is an end-to-end solution, as you're mentioning. It unifies that full patient and prescription journey in one place. It bridges automation of prior authorizations, financial assistance, refills, even embedding clinical tools and clinical insights for better clinical management of patients. And this essentially improves their transparency across the system for care teams and patients, and also those working in these workflows. It provides workflow automation, it reduces administrative burden, and ultimately it improves that time to therapy to improve patient outcomes. And within our platform, 340B is a core component as we automate 340B pre-qualification check. And I want to highlight also why 340B is so important for health system. It is considered the safety net and is the lifeline of many of the patient programs that health system utilize to support their patients. These patient programs expand medication access. They improve medication affordability. A lot of these programs are improving patient outcomes. And effective January 1st, there is going to be a major transformative shift for a specific list of high cost drugs under a 340B rebate model. And this is going to introduce a significant challenge for the health systems because it threatens the sustainability of these exact programs for health systems. It also introduces new financial risks for them and increases their administrative burden. At a time that we know health systems at the beginning of the year, their resources are stretched with other competing priorities. And due to this major impact on the health system and this new financial risk, our team of 340B experts joined Innovacer to have built a 340B rebate platform that addresses many of these issues on gravity. It unifies the disparate data, it safeguards the health system's financials, it reduces the administrative burden that lies on these health systems, all to make the challenge and the changes more manageable for our health systems.
Great. Thank you, Shilpa. I can hear the passion in your voice, which is very exciting for us this morning. Before we dive into more details around the 340B program itself, a little bit about its history and the rebate models, it's time now for the first poll, audience. So get ready, get your phones ready or get your keyboards ready. If we could put the first poll question up, Innovator team, delightful. So I'm going to read it out quickly, give you a chance to respond. When you think about the 340B rebate model and IRA changes, what is most top of mind for your organization right now? It's a single choice answer. A, cash flow and year-over-year impact. B, staff workload and manual reconciliation. C, data fragmentation across TPAs, EHRs, and wholesalers. D, compliance and audit readiness. Or E, we're still trying to understand the basics. I'll give you a few more seconds to respond, and then we'll put the response up. And it'll give our panelists a chance to kind of react to where we are as an audience. Okay, let's do 5 more seconds. All right, team, can we throw the answers up? Okay, all right, so we have a clear winner here in terms of cash flow and year-over-year impact. I think no surprise, we have a number of CFOs and finance teams on the call. I'm encouraged to see a low answer in terms of we're still trying to understand the basics. How about you, team? Any other quick reactions before I keep going?
Yes, not surprising.
All right, great. So I think you all can individually choose to close the pop-up window that reads up. All right, so we'll keep those results in mind as we move through this discussion. So Michael, let's go over to you if we could. Talk to us a little bit, rewind a little bit in terms of a brief background on the 340B program and why it matters.
Yeah, absolutely. And first, I'd like to just thank everyone for taking some time out of their day to join us. And because from my experience over the last 18 years, 340B takes a village. And that's the overall point of today's webinar is to help build a bridge and establish connections with health systems and with each of you that have joined. So Amy, I think you're spot on. Based on the list of attendees, we have a wide range of leaders on the call today. So I think it's great to start by setting the table at least, even though just 7% stated that they are trying to understand the basics. We need to take a step back and look at the history of the 340B program. So, I mean, to start out, the program is called 340B because it was Section 340B of the Public Health Service Act, and it was established by Congress in 1992. So it's been along for a while now with a simple purpose to help safety net providers stretch limited resources so they can serve more patients and improve access to care. It allows qualifying hospitals, health centers, and clinics to purchase outpatient drugs, and the key there being outpatient, at discounts up to 50% below the sticker price, and to reinvest those savings directly into that support of vulnerable populations. So when I think of 340B, I don't think of it as a bonus or an incentive-based program or extra revenue for health system. Like Shilpa mentioned, it's a financial lifeline that supports access to care for vulnerable and underserved patients. Those funds help build or sustain things like Shilpa mentioned as well, free medication programs, oncology and behavioral health systems, and charity care for uninsured patients. Hospitals can typically qualify for this program by being nonprofit. They must have a contract with local government to serve patient populations, and hospitals must meet an annual calculated threshold. So there's a lot of what goes into qualifying hospitals for this program. But over the past decade, the program has scaled in complexity and also size. So the Affordable Care Act that added additional covered entity types, the program also has become far more complex. When we look at it in terms of pharmaceutical spend, the program started in 2010 with $7 billion, or that was, sorry, $7 billion in 2010, and then $65 billion in 2023. So we've also seen major growth in the contract pharmacy arrangements. And this means this is where covered entities can partner with retail or specialty pharmacies to expand patient access beyond hospital walls and to qualify their patients for 340B. So in 2010, there were around 1,300 contract pharmacies, and in 2024, there was 33,000. So that expansion has been critical for community reach and the covered entities, but it's also introduced new compliance, data management, auditing challenges, and overall scrutiny from the manufacturers who state the program is growing too fast and without enough oversight. So a key part to this program is to know that it doesn't cost taxpayers a dime. Rather, it's funded entirely by manufacturers. So if a manufacturer wants to participate in Medicaid, then they must also participate in the 340B program. So as participation has grown, manufacturers have become increasingly focused on transparency, specifically wanting to understand, how exactly does a 340B qualify its patients for 340B? Are they doing it in terms of what we think it should be? And how are those savings used to support their health systems? And ultimately, that patient is mutually beneficial for both the manufacturer and the covered entity. So that's part of the driving, what's the tension behind the scenes we're seeing now between covered entities and manufacturers.
Right. Thanks, Michael. Yeah, I will say in terms of the conversations in the room among C-suites, it does seem like for some reason or another, I think mostly through lack of education, it feels like the conversation around 340B makes it feel like it's a conspiracy or it's super controversial. And I think it's probably more just a lack of familiarity. with the scope of it as well as its importance and how it works. So thank you for the background. Can we talk further about how the program has evolved, though, to this rebate model? And what are the problems we're seeing as a team and anticipating across the community?
Yeah, absolutely. Amy, we're on the cusp, as Shilpa mentioned, of a dynamic shift within the program like we've never seen before in 33 years. So traditionally, the 340B drug pricing program operates on upfront discount models, and covered entities purchase drugs at reduced 340B price at the time of sale. The rebate model totally flips that around. Hospitals would instead buy the drug at a full price and then later submit claim level detail to the manufacturer, which then in turn issues a rebate for the difference. So this model was introduced, and I think it's important to understand the dynamics behind it by Health Resources and Services Administration, HRSA. And its intent right now is as a pilot program to test new processes for a small group of drugs and manufacturers. So the pilot announced that 10 drugs, the same 10 drugs under the Inflation Reduction Act, Medicare drug pricing program, and would cover through January 1st, 2026. So those same 10 drugs are going to be operated through Beacon Channel Management, and it's a drug industry technology platform that's owned by Second Sight Solution. So in theory, it's designed to prevent duplicate discounts across multiple payer settings, including Medicare, Medicaid, and commercial, and give manufacturers better visibility really into the claims that they qualify for 340B. The fear, though, here is, however, it's once the rebate system is in place, it can expand past those 10 approved drugs, shifting the entire 340B framework from that upfront discount that has worked so well for those 33 years to a new retrospective rebate process that's going to come with a variety of challenges. And like our survey said, they're most concerned about cash flow problems. It's also going to create some significant administrative burdens. So hospitals must float their higher drug cost while waiting for rebate payments. And according to a survey, Dish hospitals have stated that they expect a $72 million increase in their actual float. And these dollars could be used otherwise to support patient care, safety net programs, operations, and in some dire situations, these funds are essential to help hospitals keep their doors open. So beyond this financial strain too, I have to stress that this is a major operational lift and it's substantial. Data needed for the rebate submissions isn't just stored in one place. It's scattered across multiple 340B management software, EHRs, and procurement platforms. So hospitals must compile and normalize all that data to submit it to Beacon. It's also key to note more about Beacon is that it's independently selected by manufacturers and not our health systems or HRSA. Manufacturers can elect also to use a different platform if they choose, or use their own methodologies if they choose. So I suspect there will be other platforms in the future, and I think the community does as well. And this means that data fragmentation and really complexity for 340B covered entities is only going to increase.
Yeah, I think Michael makes a very important point that I just want to emphasize. I think we already know that there's, your EMR and your 340B TPA are already separate systems, right? Creating more fragmentation. And what Michael stated is now you're putting additional things in the mix. And this fragmentation again really just means that health systems end up shouldering most of that administrative work, right? And anyone who's been part of this program for many years, I think that's no surprise either. It's often health systems that end up shouldering all of the extra work, right? That's either required by manufacturers or by policies or updates on regulatory requirements. So I think what's important to stress is really the collecting of the data, the formatting, the uploading, and then really tracking your rebates and reconciliation. Many times maybe to, people who aren't as familiar or deep experts to the program, they might think it's not not a major burden, but all of this really is a full-time responsibility for health system 340B leaders. It increases, costs from a health system perspective, slows payments, and really shifts even more of the risk from the manufacturer side to the hospital side. And I would stress that this is precisely where AI and automation have really showed impact. And we'll touch on that more, but really, AI and automation to reduce administrative burden on the health system side, whether it's for the 340B program or for many other areas, even outside of pharmacy, is really an important point to focus on, to lessen the burden on our clinicians, because that's the most important thing is we want our clinicians really focusing on patient care, versus all of this administrative burden that we often get tasked with.
Thank you, Jigger, for the emphasis. Right. I think in terms of the poll responses, cash flow was first, but second or third in there was the staffing, workload, and manual reconciliation. And they are obviously integrally tied together as we have to hire more staff. If we don't have the automation and tools, they will feed into each other into this, unfortunate cycle in terms of costs. Michael, if I could come back and double click on one thing you mentioned in terms of the Inflation Reduction Act, and how it sort of ties in and overlaps here. But can I hone in a little bit more to help me understand and maybe the audience a little bit better in terms of there is another rebate model that ties back to the Inflation Reduction Act, and how does that fit into the broader 340B and rebate conversation?
Yeah, absolutely. We have to set the table for this one too. So a lot going on and a lot going live come in a few weeks here as the new year kicks off. So the Inflation Reduction Act essentially fundamentally changes how the government pays for prescription drugs. It created the Medicare Drug Price Negotiation Program. This allows CMS to negotiate prices directly with manufacturers and establish what's called the maximum fair price, or MFP. So those 10 pre-selected high-cost drugs that are also part of the 340B rebate model is part of the IRA Reduction Act model as well. So the program is specific for the IRA segment, for patients with Medicare Part D insurance, and will expand to Medicare Part B in 2027. So in terms of drugs, all of this, starts with those 10 drugs in January 2026. In 2027, CMS will add 15 more. Those were just recently announced about 2 weeks ago of what those will be. And in 2028, another 15 drugs will be added. And in 2029, 20 are new drugs each year. So what this means by the early 2030s, dozens of high spend therapies will be under this negotiated pricing. And the overall framework is expected potentially to expand beyond Medicare, and influence other federal or commercial payers and aligned with broader drug pricing reforms that are going on. So to put this in scope, for 2029, it's projected to reach about 40 to 50% of the total drug spend. And as I mentioned, the fear of the 340B rebate model side is that manufacturers are going to push for 100% of the 340B activity to be processed through a rebate. So back to the IRA portion though, CMS created a Medicare Transaction Facilitator, or MTF. This is almost like their version of the Beacon platform that we talked about. And it securely manages claim level data that ensures manufacturers issue proper rebates to those dispensing entities. So here's where it overlaps directly with 340B covered entities. If a covered entity has its own internal specialty or contract pharmacy footprint and dispenses one of those negotiated drugs to a Medicare patient, it must report that through the MTF to ensure they obtain that rebate to cover the cost of dispensing that medication. Because the pharmacy is being asked to dispense this medication at a loss and then wait for the rebate to make them whole again. So essentially, covered entities will be responsible for managing these two parallel rebate payment pathways, and under one through CMS and the IRA drugs, and another through the determined maybe multiple platforms in the future related to 340B. So each program has its own set of data requirements and reporting requirements and workflows, timelines, payment rules, both directly affect the hospital financial planning and that important piece that we talked about, the cash flow and the operational uh, tendencies that this is going to take. So as the model, is expected to expand with years to come, the administrative overlap here we're talking about as timing risk will only grow. The data alignment, the automation and forecasting tools really aren't just optional anymore. They're essential to keep those programs compliant and financially sustainable.
Okay, so
Yeah,
sorry, go ahead, Jigger.
yeah, I was going to add, if there was a survey posted, I think yesterday or the day before on modern healthcare on the 340B rebate model, very similar to some of the results we just saw on our survey here, really showing exactly what Michael is stating, that, not only is this really a cash flow issue, but even a potential, it's not just a timing issue, but it's really a reconciliation issue as well, which may lead to this complexity may end up leading to actually decreasing your 340B rebate dollars in this rebate model, right? So overall major impact that is really not predictable. So I actually texted with the CFO this morning and really asked him directly, do you know your 2026 impact? And he was, very direct and said he does not actually know the impact, right? So even for these 10 medications, and then when you throw IRA in there, really getting this really determined very precisely, I think is what the CFOs are seeking. And I don't think they know just yet, even though this is going live in less than a month, what that real impact is.
Okay, so let's dig deeper into it. We're right at the meat of our of our presentation and the crux of what I think the audience wants to talk about in terms of what's top of mind for most CFOs to be aware of, or finance teams in general, and how will the overlapping rebate models affect hospital finances?
Yeah, let me take that one and also, a little bit further education on both models and why this is going to be very complex is the IRA model has a 14-day payment requirement, and the 340B pilot simply just expects payments to be within 10 days. And what I'm trying to state here is for the IRA model, CMS has direct oversight of that requirement, and if manufacturers fail to comply, there's a civil monetary penalty of 10 times the amount of the rebate. However, the 340B rebate model that's overseen by HRSA has no real binding rules or enforcement mechanisms. They could potentially kick a manufacturer out of the pilot program, but as we've seen in the past, a lot of this goes down to litigation between HRSA and manufacturers, and at most times, manufacturers tend to win. So manufacturers can delay or deny payments for weeks or even months, citing data discrepancies or system issues or policy discrepancies. And upfront, we're anticipating a denial rate from anywhere from 2 to 5% of claims submitted. But we also expect this number to potentially grow. Manufacturers may make this easier upfront. Let's make the pilot more adoptable for covered entities, but it's going to be interesting to see how we track this moving forward. The delay really for hospitals, though, means they're holding large balances on their books and money's tied up. It's pending rebates instead of being available for that patient care and operational cost that we talked about. So it's not necessarily a timing issue anymore for our finance directors and CFOs. It's predicting it for them of what exactly are they expecting to see and by when. So I've been in that seat before and building and running a 340B program. I was lucky enough to have a great team to help navigate some of these changes and headwinds as they came up. The reality is when a new requirement hits the 340B program administrator's desk, it hits them pretty hard. Like they have grit and they have determination to get it through it, and they may not show it up front. But you don't just switch a a switch and flip it on, and you have everything that you need. You have to use analysts, coordinators, potentially pharmacists spending hours pulling data from these multiple system and EHR and wholesalers to provide that information that a hospital needs to plan better. Because they're going to get asked, how much from this rebate model is pending, how much is going to be denied, and what can we actually count on this quarter. So, uh, prior 340B and health system experience matched with Innovasor's technology, and I've seen it now, and I'm very impressed with the product that we're going to bring to market. This is where it creates that magic, is matching our experience with their technology. The tool that we've created is really nothing like I've seen in the space before, and it's really going to make life easier for our partners so they can turn their focus back to those patient care initiatives.
Yeah, and I'll just add, I like the saying, control the controllable. So we really can't avoid the regulatory complexity that is coming live. But really, with this tool, as Michael was stating, you can measure it, manage it, and really plan around it better. And so what we're talking about is really not just kind of like an advisory service where we're telling you how to do it properly, but you really need that tool behind the experts to really make that happen. And that's why we believe that we have the right solution that speaks the language both of pharmacy as well as finance.
So let me just quickly summarize those three biggest needs that I see from my standpoint. Is unified data and visibility. So a single reconciled view that brings together those 340B claims and IRA related activity, and the rebate reconciliation status is going to become very important. So that way pharmacy and finance are working from the same lens. And then lastly, or secondly, the predictive cash flow is both needed for drug spend and those incoming rebate checks. So a solution that's not only just collecting the rebate dollars and tracks that income, but compares it to what you previously saw in the year prior, into the same level of drugs or new drugs that are added, and how it increases in drug spend and revenue moving forward. And then lastly, like we've touched on this, is that operational relief and automation. Technology that reduces the manual touches that we need to do, and hospital teams can then focus that back to compliance and strategy and not just use spreadsheets any longer. But Longitude RX, and we've already touched on this, what we differentiate and bring is the expertise at all levels. So frontline 340B operations and C-suite strategists with a pretty diverse background. So we also partner with our health systems to collect EHR data and 340B TPA data to reduce that fragmentation so it's not just sitting in a silo. And our partnership with Innovator, we can surface real-time reconciliation and denial queues and dashboards at a high level for those CFOs and the 340B program managers, so they're speaking the same language.
Great. Thank you for the quick summary, Michael. I appreciate
Oh,
it.
and I
Shilpa?
want to just quickly add, as Michael has mentioned, that the reality is that the 340B program is not static. As he's told us, it's complex, it's continuously evolving, it's very dynamic. So we intentionally designed the product to be adaptable with marrying the expertise of the 340B team that's going to be providing guidance and oversight and staying abreast of all this dynamic, evolving changes in regulations and policies. We're going to be very quick in adapting and translating those regulatory changes into the platform itself so we can ensure that health systems stay compliant and that they can respond to any of those HRSA guidance or any of those manufacturing policy changes that occur. And I think that is a huge differentiator that Michael has already pointed to, but I wanted to just echo that as well.
Thank you, Shilpa. Okay, so Maddie, you've been waiting patiently and we're coming to your portion of this agenda. But first, I'd like to introduce our second and final poll to the audience before we move into the deeper tech and gravity discussion. So team, if we could put up this second poll, and audience, if you could get ready to read and respond. Perfect. This will help us for the next set of discussion questions. So how prepared would you say your organization is today for 340B rebate-based workflows, e.g. the pilot and overlapping IRA refunds? Again, a single choice answer from A, very prepared, strategy and tools are in place. B, somewhat prepared, we have a plan, but gaps remain. C, aware, but not prepared. We're still figuring out our approach. And finally, D, not prepared. This is all very new. Would appreciate your honest answers in terms of your perspective on the organization. Let's give 10 more seconds. Maddie's curious about what this answer will be. All right, team. Okay, team, can we see the results? Okay. Be somewhat prepared is the leading answer by far, followed by C. So unfortunately, not as many in the very prepared state as we'd like, but I think that's why you all are here, right? Any other quick reactions before I move on?
I think this is a good reflection. And also because this is also dynamic and evolving, it's natural that health system also feels like there's gaps that are remaining because as Michael is pointing out, there may be continuous changes that we need to stay abreast and quick and nimble to adapt to.
Absolutely. Okay, so now we have a read on the audience's level of awareness as well as preparedness. So, and we've talked about changes in the regulatory landscape. Thank you again, Michael, as well as upcoming operational realities. So let's turn to technology, how we can make this manageable day to day. Maddie, can you walk us through how Innovasor's Gravity platform supports 340B rebate management, data interoperability, and everybody's favorite word, dashboards?
Absolutely, Amy. And wow, we have such an awesome team here, basically talking about 340B and the complexities. So really grateful to be part of this team and the partnership. At Innovacor, our focus is on building a unified data and intelligence platform called Gravity, which I shared earlier. That allows health systems to manage 340B and rebate workflows with accuracy, automation, and then full visibility, right? Today, what I'm going to do is walk through 5 key capabilities that we have built. And Michael, our 340B guru here in the room, please chime in on the 340B implications as I walk through different capabilities. The first one to start is the unified claims eligibility workflows. So one of the earliest challenges we set out to solve is that fragmented eligibility that we talked about, and Jigger and Shilpa and all of you like touched upon this about the aspect of like this data being extremely fragmented. Most health systems today, you folks like rely on multiple TPAs or split billing systems, which really are disjointed and don't really talk to each other. And what is the impact of this is could be like lost eligible claims, missed 340B savings, probably also duplicate touches and manual investigations, and no clear line of sight into where opportunities or risks exist, right? With Gravity Platform, what we do is we unify the eligibility logic across all these various sources that we just talked about and pair it with automation. So ultimately, what happens is we ensure that every eligible claim is like captured, flags like lots of whatever inconsistencies we see across like different TPAs and so forth, but also like surfaces why a claim failed eligibility, which is super crucial, ultimately to kind of reduce that noise for like pharmacy teams. Michael, did you want to add anything here?
Yeah, that's the biggest part, I think, for 340B teams or even hospital. They may spend hours or a lot of resource dollars chasing expectations, related to reconciliation or even just building something themselves. We see some people feel like they have a plan, but that plan, in the end costs money to create. And when you centralize all of this activity, like Innovator's capability of doing, you improve compliance, you protect your revenue, and most importantly, you free up your staff to focus on their strategy and instead of firefighting. They're also then able to focus more on that patient care that we've talked about.
Absolutely. That centralizing that, eligibility logic and data has definitely a lot of power and really creates that strong foundation for the other capabilities that I'm going to talk about. The second major capability is predictive rebate and cash flow modeling, which I know was top of the mind for all of you, which is also becoming mission critical under given the rebate-driven pricing models that are going to come into action. Manufacturers may delay, they might deny, or even like dispute the payments. And hospitals will need a way to kind of project when revenue will land, which is going to be super crucial for managing that cash flow. So our AI models essentially predict when each rebate could post based on the given data and quantify expected revenue per claim, right? Which is really helps with that predictability aspect of the cash flow. And then highlight variances when manufacturers underpay. So really like bringing all that transparency into how claims and rebates are going to get paid back, but then also what the impact of that is on the revenue, and ultimately like automating like the identification of claims likely to be denied, right? If we know and we can forecast that ahead of time and predict that, that kind of then allows and helps hospital organizations to manage their cash flow very effectively. So this will give the finance teams a very kind of forward-looking view of cash flow instead of like waiting for surprises around any kind of these numbers.
Yeah, I think, Batty, essentially what you're saying is without this predictive modeling, CFOs, finance directors, pharmacy departments are operating like with the lights out. They're completely in the dark. With it, they can forecast, cash per positions, identify payment delays before they hurt, identify trends also within payment delays, like which manufacturer is not paying and what's the reason behind they're not paying. Like our dashboard is going to clearly state and be almost an actionable item to go and try to navigate specifically to that area that you can scale back potentially or raise your hand and state that why is this occurring and how can we increase the amount of cash flow that we're seeing come back. It also helps prioritize, like I said, which manufacturers need to be disputed and just automation like this, truly stabilizes a 340B program and makes this very complex new thing less complex at the end of the day.
Absolutely, Michael. Very well said. The next feature, which is kind of the third one, is I think really probably top of the mind for a lot of you as well, is those financial dashboards, which are extremely centralized. So we build out dashboards directly on Innovator's analytics platform. These dashboards essentially pull together the wholesaler data, TPA outputs, claim level eligibility files, manufacturer rebate systems like Beacon, right? We are really bringing everything together in one platform in order to provide visibility and transparency into the financial aspects of this program. Now, from there, we will give pharmacy and finance teams like yourself a single source of truth where you can monitor KPIs, track all receivables, probably visualize performance trends, and then model like the best case and the worst case scenarios. So you're really ready for when this program hits. We even designed kind of scenario engines, right? Like that support questions like, what if we adjust this formulary? Or what happens if manufacturer X like extends payment timelines? Like what does that impact to our organization? That's what these dashboards are gonna empower you all with and provide those really actionable insights that you can then go kind of tackle, as and when those pop up.
Yeah, this is truly something that teams within the hospital setting have never had access to before. It was always something that we've talked about in the past, but to do that scenario engine and put in those testing parameters to then understand, what is going to be the impact of that if we do make that change is going to be a pretty cool feature within our platform.
Awesome. We're very excited. The next one is the continuous audit and compliance assurance. It's super crucial. We need that audit and compliance, not just kind of like a one-time thing, but in a very continuous fashion. And automation really enables us to do that today. Auditing in 340B is, you all know, typically very manual and stressful. But with rebate models, this ongoing validation is going to be even more critical and mandatory, right? So this capability that we build really gives like covered entities bulk automated audits, so you can do them, in a kind of automated way, stress-free way, and they just happen for you. Targeted claim reviews. We can also do like real-time eligibility validation, role-based action lists for various different staff members that you have. And then again, full dashboards providing you that audit findings, right? Whenever those audits go through, like whatever the findings are, they are available to you right away. And then completing the audit trails for, as all of you will have to do, the HRSA audits, the manufacturers will have inquiries that you might have to audit as well. And then just from a state level, there's also like transparency for those reviews. What the platform does is essentially translates all this raw data into very valuable and actionable like summaries and visuals, provides deeper insights into the risks, not just as kind of a static export, right? Like where it's a one-time report that you get, but this is where we're saying like this is going to be completely continuous on a continuous basis. So you can have kind of pulse on your business and this audit and the whole 340B program overall.
Yeah, Maddie, you've nailed it here. Manufacturers are essentially now the watchdog. Like they're going to have all of this data in their hands as well. And not only just manufacturers, but state and federal committees are really demanding transparency. So 7 states now are increasing their request for more information related to the 340B program be submitted directly to them. And I think the level of detail that we've provided within the platform and pulling all of those data silos now into one segment, it helps us proactively manage that compliance and respond to when those inquiries do come up, that we're able to do it quickly. Luckily enough, we had a team in my previous role that would help with these type of inquiries, but it took a lot of effort and a lot of administrative work to prepare those in a way that we felt comfortable with. I feel like with a tool like this, not only can it help you with your audits being done faster on a monthly basis, but just being able to pull that inquiry and detail a lot faster using AI technology is going to be a major advancement in exactly what this space needs.
Absolutely, Michael. And the last but not the least is the intelligent replenishment and optimization tools. Another area we have invested heavily in is this particular one, because 340B is now extremely intertwined with the rebate timing and how we use this for like real-time utilization and predictive modeling, right? Like, so the predictive modeling that we have done is really to align replenishment with expected rebate inflows. Also to prevent over purchasing, at WAC, normalizing cash flow, cash outflows, and then really honing in on how do we optimize the inventory efficiency, right? This will ultimately like help avoid situations where a hospital buys too much at a full price and then they have to wait for months and months and months for reimbursement. So this is essentially the toolkit that we have within Gravity that really helps with the replenishment and providing all kinds of optimizations for reimbursement and so forth.
Great,
All
thank
right.
you.
Yeah, I just want to
So,
kind of talk one last thing about the product. So overall, the solution that we just talked about, having those five key capabilities that we have today, is a highly integrated experience. The data is unified. There are lots of predictive modeling that provides you insights into, or foresights really, into cash flows and the finances and replenishments. And this entire system that we build is really providing that deeper transparency into how everything flows. And one that really finally brings together like the clinical, the operational, and the financial components of 340B and the rebate workflows. Over to you, Amy.
Thank you, Maddie. I'm excited to see all of this come to life. The integrated dashboard is, my favorite thing, to be able to see everything in one place. And I know it is obviously for teams as well that have to manage. We've got 5 minutes left and we've got questions coming in from the audience. I just want to reiterate, if you have questions for us, feel free to submit them. And like I said at the beginning of the webinar, we will address them afterward and send answers via email. But we're going to try and get through a few right now because I love this question in terms of I always like to leave a conversation with some homework and some action items for folks. So number one, for organizations that are still in awareness mode on the 340B rebate pilot, what's the first practical step that you should take after leaving this webinar? Michael,
Yeah,
do you want to start us off?
yeah, I can take that one. I talked about it takes a village, right, for 340B, and we're trying to build that bridge. So I would suggest reaching out to us as quickly as you possible for a webinar or after the webinar for a demo so you can learn more about our solution and see it as soon as possible. So that would be my kind of recommendation. But essentially what, the homework should be is you need to do a baseline assessment. Identify those pilot drugs that you use today and map those claims of which pharmacies are using them, which TPAs, all of those data silos. You're gonna have to do that manually up front unless you reach out to us. But document all of that together and where it currently lives, and I think then bring that picture back to a design team, including your pharmacy and finance and IT and compliance, and come up with a shared definition of truly what the problem is. Like, what are you trying to solve for? Is it cash flow, like we've seen in the survey? Is it workload or data fragmentation? What is it? And what solutions are out there that can help us solve for it?
Great. Thank you, Michael. Second question, if no other responses to that one. Okay, so what's a realistic timeline for a health system to stand up rebate reconciliation and dashboarding capability? Shilpa?
Yeah, I was going to say I can take that one. That's a great question, actually. So, if a health system already has data feeds in place with their TPA, we can stand up the foundational rebate process and the dashboarding relatively quickly because of our integration. We already have the framework set for the ingestion and standardization, so we're not working from scratch. Our approach is essentially intentionally phased out. We want to begin with like the highest impact use cases so that the health system can see their immediate visibility of their rebate performance, and the cash flow that we've been talking about is critical for the health system. And from there, we can expand the functionalities as we get more data coming across.
Okay, perfect. I'm racing to the finish with 2 minutes left. I think I can squeeze in one more as well as my closing remarks. And this should resonate with both our CFOs as well as our partners within internal organizations. What would you say to a CFO who's skeptical that another platform can truly reduce complexity? Who wants to take it? Jigger?
Sure. I think this is a great question. As we said before, we understand we don't want just another shiny object or software that needs to be implemented. But the reality is that your current rev cycle company is not going to have the expertise in this area to make this predictable for you, right? So I think given that it's a complex area and similar to what Michael said, we're not just talking about a solution or a tech platform. We're talking about experts like Michael, really ensuring that we're paying attention to your workflows when we integrate what we just talked about, right? And I think I like the point it takes a village. Really, we're here to support from a tech as well as people and expert perspective to make sure that these workflows are really embedded so that the predictability is there.
Thank you, Jigger. Quick answer, but we're obviously happy to continue the dialogue. I'm just about at time, so I just want to say a quick thank you again to all of our speakers, to Jigger, Shilpa, Michael, and Maddie. Again, if you submitted questions that we weren't able to get to, we will get to them afterward and send answers via email. To learn more about how Longitude RX and Innovacer are partnering to support rebate readiness and to schedule a demo, please reach out to, get ready, 340B rebate at longituderx.org. Again, that's 340B rebate at longituderx.org. And just thank you for spending time with us. We hope the conversation today helps you prepare for the next chapter of 340B, and we look forward to collaborating with you all to drive financial resilience and program integrity for the communities that you all serve. And finally, from the entire Longitude and Innovacer family to yours, we wish you all a very happy and healthy holiday season.